welcome to the 2024 North Carolina Medical Society Candidate Series. I'm Randy Aldridge with the Medical Society, and I'm here with Dr. Timothy Reeder, who is in the House of Representatives District 9. Thank you very much for joining us today, Dr. Reeder. As you know, we have invited all of our members who are running for office to talk with us, so we've got a lot of subjects we want to cover with you.
Thanks very much for having me here today.
I am very excited about this. You're running for re-election, and I just want to get an idea of what your campaign is like and what's motivated you to run again.
Well, I've had a really great year. It's been, believe it or not, a lot of fun to be able to influence the policies of the state of North Carolina on health and education and economics. So that part has been really a lot of fun for me to do that. So, and it's also, you spend a lot of work trying to get in the first time. And so to run for re-election just seems like a lot of wasted effort.
That's a good point. That's a very good point. Let's talk about some stuff that a lot of our members are talking about. The state of North Carolina, of course, has a sizable population that lives in rural communities. And as I'm sure you know, that creates some healthcare gaps. Since you are running for re-election, what do you think you can do legislatively to help that problem?
So I was really happy that we did a lot of work in the budget this year just to address rural healthcare. Probably the biggest one was Medicaid expansion. For areas like mine, Medicaid expansion really is a lifeline to the healthcare facilities, the hospitals, and the providers. We did other things like loan repayment and scholarships to help encourage physicians to go to rural areas. Those things were all going to help over the long term to try to increase that. We looked at ways with which we can increase incentives for clerkships, because we know if we can recruit and train people in rural areas, they're much more likely to stay. So all of those things were really important for what we're trying to do in rural health.
And you mentioned Medicaid, of course, 600,000 North Carolinians roughly now able to get Medicaid with Medicaid expansion. That's a really historic thing for the state. How do you think we can build on that?
Well, I think that Medicaid expansion, it's a start. It brings coverage to people who otherwise weren't. But as I've said many times, if we think Medicaid expansion is going to solve our healthcare problems, it's not. It really is a lifeline to some health systems and to a lot of our citizens. But the goal really is to get people jobs and real insurance, because that's really how we're going to fundamentally help the health of North Carolina. Medicaid helps, but that shouldn't be our end game.
And since you brought up getting more people jobs, any plans for how you might do that in your next term?
Well, I think that North Carolina has done really well over the last several years with our tax package of cutting taxes, with doing targeted economic development. All of those things are really important. And North Carolina, for 2 years running now, has been voted on as the best state to do business. I just saw a report the other day that we were the 9th best state for starting a new business. So I think those are all really good, because when you have a growing economy, people with jobs, that stimulates people to stay. It brings in tax revenue. It helps our education system because there's more money there. That's really, if the state's not growing economically, we're not going to be successful in the other endeavors that we're trying to do.
I want to switch gears a bit. You're a physician, so I'm going to say two words that I'm sure you're familiar with. Prior authorization. Yes. Our members, of course, are talking about it quite a bit and how it restricts healthcare for a lot of their patients. Let's talk about what you can do to help fix this problem here in the state.
So I was really happy that we filed a bill in the House to really upend prior authorization and really minimize the burden on physicians and their practices. It made it through the House. It got caught up in the Senate. So we still have an opportunity in the short session to try to get that through. What I believe very strongly is if we can reduce the burdens on physicians, it's going to allow physicians to practice longer because they're not going to be burned out. The other thing, if we just look at efficiency, if we could take 10% of the workload off for physicians, we don't have to recruit as many physicians because we're 10% more productive without any other people. So one of the goals that I've had in the legislature is what other things can we do to minimize the burdensome regulations and things that takes physicians away from their patients.
You mentioned physician burnout, and I know there's no crystal ball with all of this, but as you look forward in the healthcare world, there's a lot of things on the horizon that are concerning to our members and physicians everywhere. Things like burnout and things that are coming down the pipe, like AI, telehealth, mental health, things like that the people of North Carolina really need. And I'm not asking you really say anything specific, but as you look down the road, What do you think is happening with healthcare in North Carolina? And if you're reelected, what are some things you want to get passed?
Yeah. The healthcare system was struggling before COVID. COVID really changed in a bad way the healthcare system. So the system is not functioning well, and you can look at any measure for that. I believe that some of the things that we need to do is get physicians back taking care of patients and mitigating and reducing some of those burdens that we face. Using the tools and the technology to help us to be more efficient is really important. So reducing things like prior authorization. Can we do something with easier credentialing? What other things can we do to physicians to make it easier to practice so that they want to keep practicing long term? That will help in a significant way to reduce the burnout that we have. It will also increase the availability, the access to physicians that we need.
Any last comments you want to make to the members of the Medical Society?
It's really important for us in the legislature to hear the physician voice. One of the things that I've done a lot this year is talk to physician groups about how to make sure that they are engaged in the process. And it's not just policy, it's politics. And so it's really important. Physicians, I don't know if you know this, we actually vote less than the general population.
I did not know that.
So the basic thing is we need to show up and we need to vote. We need to develop relationships with our legislators on both sides of the aisle, and we need to get involved in any number of different ways. So that's what I would say to the members is if we don't hear from you, we're not going to know what you know. And so you really need to make an effort to come talk to your local legislators on both sides, in the House and the Senate, and develop those relationships. They're so important to improving health.
I couldn't agree more. Thanks so much for being with us. If anybody's interested in finding out more about your campaign, how can they find out that information?
drtimreader.com is my campaign website. If you're looking from a legislative, it's timothy.reader@ncleg.gov.
All right. We'll make sure we put all that information on our website as well. Thank you to Dr. Reader for being here today, and keep watching here at the North Carolina Medical Society for more from our member candidates in the 2024 North Carolina Medical Society Candidate Series.